is the proliferation of bath salts in our community. The bath salts are having a significant impact on the people in our community, on the facilities in our community. The use of the bath salts has been occurring at an alarming rate. Carol Seltzer, who's with me, represents Crisis Intervention. She's the director of the program there, and we've had numerous conversations recently discussing the number of folks that are showing up at the Crisis Intervention program. When we were waiting out here, we were just discussing a central Pennsylvania physician who was kind of the go-to man for some of these things for 50 hospitals. Back at the end of January, he was getting 1 call a day on average from the 50 hospitals that he was serving. And I think, as Carol and I discussed it, Crisis Intervention is seeing at least on average, one person a day here in Lebanon County who's under the influence of bath salts. And certainly those are the ones that are having significant problems, and I don't think it even touches the number of people that are actually using them and not showing up needing either medical or psychiatric care for those. I've said to folks, it's like a bad movie. This substance is available over the counter without restriction. At this point, there are no laws that prevent the use of the bath salts. It's readily available at corner convenience stores, which is disturbing on many levels, and on one level it gives it an air of legitimacy and safety, which certainly is not true. There are major side effects of it from using it, and I think we're all wishing that some legislation would be passed quickly that would make them illegal. Some municipalities are doing it municipality by municipality as opposed to a statewide ban. I think it was Mount Carmel Township had banned it. Luzerne County had banned it, I think, by a judge's court order, and several other counties. To the best of my knowledge, unless it's happened recently, I don't know of any other states that have actually implemented a ban on the sale of the bath salts. But we're here today to express our extreme concern about this problem. Of course, I know we always have your support when we're dealing with these issues, but I think Carol, who's I always say is in the trenches and seeing the behaviors, can probably give you some more information, and certainly Dr. Yoakum is dealing with this issue as well. And some of the tales that I get are horrifying in terms of the behaviors. I think we just had a pregnant woman using them. The effects are lasting, as with many drugs which are out of the system within a short period of time. Sometimes these effects are lasting for days and sometimes weeks. And the behaviors are bizarre, behaviors are aggressive, behaviors are dangerous. And we're very concerned about all those factors, and concerned about the health and safety and welfare of the people in our community when, from a medical standpoint, of the people using them, and also people who might be victims eventually of any violence that may occur because of the behaviors associated with this. I don't know who wants to add anything.
I have 2 questions.
Absolutely.
Go ahead, answer your questions, Emily.
All right.
Go ahead.
The first question is, if they're not labeled, how will a parent identify that it's a bath salt? What do they look like? And the second question is, how are these, I'm ignorant, how are these bath salts taken into their body?
I think the traditional way is
Anyway,
snorting.
they smoke them, they snort them in.
Anyway, okay.
Yep.
And what do they look like?
You would see them in metal tins, but it's a
metal
fine
tin,
white powder.
fine white powder. It comes in little glass containers. They're like a little perfume, you know.
It's like a lip balm. This is actually called Snow Leopard. Obviously, there's nothing in here. I picked this up off the street. But it's a crystal like a cocaine. And Sally has lots of samples.
As incense, basically, and the K2, which is a synthetic marijuana, is sold as incense. The bath salts is sold as synthetic cocaine. It just looks like a powdery substance, and most of the stuff that we've confiscated, or the containers, are in that shape. Now, they have different labels on them. All of the labels say that they're not for human consumption, of course, But they're all like different brand names, it's all the same thing. Same thing with the synthetic marijuana. They come in a packet that looks about like this, and they have different labels on it as well, but all of it looks the same once you open the packet, and it's all sold not for human consumption.
Like incense, then can a whole room full of people become infected or whatever you say?
Well, I guess I would question the effects of that if you're doing it that way, unless you have it in a bomb.
Well, if you had
But
enough of it and you had the
Right.
ventilation shut off, the answer is yes.
Right. The ingestion, as far as the ingestion, the quicker it gets into your body, the shorter period of high that you're going to have. 9 of us went to a training up at the Hershey Med Center about 2 weeks ago, and there was an ER doctor who put on a presentation about it. So I think the important thing right now is that as many people that have to deal with it are getting educated about its effects and what to do with it, and how you handle it. And one of the things we've been successful with in not getting into physical confrontation is the taser, right? We have had less physical confrontations with that taser. The need to get involved in a physical confrontation when we're initiating arrests. The bath salts, they are telling you that tasers do not work for individuals that are on bath salts. It is 20 to 30 times the high of cocaine, and they're telling you that you need to use a hard hands approach at arresting. So now we're going back to, moving my officer's firearms in harm's way when you're physically trying to subdue someone. We've had every week, the past several weeks, I've had half of my officers, and Carol can attest to this, at the Good Samaritan, at the getting medical clearance as a result of these substances. It's very serious, and it's affecting our community in a pretty serious, significant way right now.
And people are using them because they're not worried about drug testing.
You can't test for it?
You can, but very expensive. At this point, a regular drug screen that we would do at the clinic, the methadone clinic, or Sally would do, it's not detectable. So they think they can do it. You don't have to worry about their parole officer or
Displaying these psychotic symptoms. So what do we do with someone who we know is on bath salts but are displaying these psychotic symptoms? So we're utilizing different places to house them until we can get them psychiatric care. And soon the insurance companies are going to say, hey, we're not going to pay for this, but because they are paranoid and delusional and hallucinating and suicidal and homicidal, it's very dangerous.
Have you been getting involuntary commitments then as a result of that?
Oh, yes, absolutely.
That's what I thought.
Absolutely.
And the other part too is facilities are becoming reluctant to take them because of the behaviors, the aggression and the violence that their staff is subjected to.
Other than education, how can we stop this epidemic?
Well, if you don't mind, I can talk about that. Currently, there is a House bill and a Senate bill. The Senate bill made it through the Judiciary Committee on the 24th of May, and according to Maureen Gingrich's office, it was laid on the table, and they were unable to give me any further explanation as to what exactly that means and whether or not a bill making it illegal would go into effect by this summer, which we're here right now. Other counties, I did some research last week. Luzerne County, the president judge put a ban county-wide on the sale of any synthetic drugs. Center County did as well, and so did Clearfield County. So they didn't just go by jurisdiction, they actually put a ban on the sale of it countywide. Now, would that solve the problem? No, of course not. They'll be bringing it in, but it would certainly, people wouldn't have the opportunity to go to the gas station that's 2 blocks from their house to pick it up. There's another, Lackawanna put a ban within the city limits, so they didn't do it countywide, but there is a ban within the city limits.
Does Judge Tilwalk have any intention of pursuing that avenue?
I think, I actually just came from there, he would be interested in anything that was presented to him, but someone else, either a group of us or the district attorney, would need to present something to him. It would be in an injunction order, I believe is what they call it, for consideration. But I think it's definitely something that he would give consideration to doing.
And this is affecting, young and old alike. We're obviously seeing it in the schools. the middle schools where they're starting out, and again, it's the availability, the access to it is very easy. All over Lebanon County, it's sold and everyone knows where it is. They're coming in from other states. We had talked about that the other day. You know, this is the place to get it. So they're coming here, and you know, like I said, there's no.
What does it cost?
These vials are about $30.
Really?
But again, compared to when you're talking about cocaine and you have a $1,000 a week cocaine habit, you get 2 vials for $60. It's pretty cheap. So and the synthetic marijuana is anywhere from like $10 to $15 for a packet.
I bought it for 11.
We had an episode that involved a married couple, and there were 3 kids. Both the individuals were under the influence, and they were both accusing each other of choking each other out. I mean, people get violent on this stuff. We've had people in the office that were in the interview room that you kind of like don't know, should you touch them? Should you let them? You know, what are you supposed to do? Because you touch them, where are you going to go with them? I mean, central booking's not really, with all due respect to central booking, they're not equipped to deal with them. I would, you know, Carol, the prison, people aren't taking them. It's like, whoa. And it's, I don't know,
We have
scare
a lot
pretty
of that
easy,
with the
but
families. It's really, we had another couple, unmarried, but they forgot to pick up their children at school. So the school called, and school got out at 3 o'clock, and this was 5 o'clock, and where are the parents? And we went, and the parents were in bed and admitted to using the bath salts. We were approached with a samurai sword that was actually in the newspaper. You know, these kids were telling us that, you know, we had to go every day this week. We went to a different relative's house because Daddy said there was somebody coming in through the vents, and we were boarding up our house. And so it's affecting whole families. Children and youth has been involved, and so it's very scary. It's very scary. This is hitting new people. We're surprised the age group, 40s, 50s, that are not drug users. And certainly, again, because
Is a government body going to be pressing President Judge for a ban?
I'm just
Similar to
curious
what
if they have
was-
the authority to do that.
Well,
I mean, it's a
thought,
legal substance they're selling to people. How can a judge, what if he decides he doesn't want to drink milk? He's gonna ban milk? I'm not so sure that he can do that.
it has been done in other counties.
Yeah, but that doesn't mean it's
Right,
legal.
Right.
Or that it's effective.
Yeah.
I can tell you that after last week, and last week has been a repeat of several weeks. I think it just hit me because I had half of my staff at the ER for 2 days.
Patients and paranoia of the bath salts, but still a different effect than we've seen with regular marijuana and needing medical and or psychiatric treatment.
How long does it take you to diagnose exactly why they're there, which substance?
tell you.
Oh, they tell you?
Oh, absolutely. They're telling us. I mean, they're telling us if we ask them, but bath salts is really easy to pick out.
They don't tell us.
Oh, well, they don't tell you, but they tell us.
We had a guy trying to pull his teeth out of our office. I mean, he had half of his fist in his mouth trying to pull his teeth, and we weren't sure whether to call you or...
I actually visited with each police department and said, how are we going to handle this? When they get a call, because they're getting the call initially, how are we going to handle this? And so we're working really well with the police departments as a team, responding and saying, okay, here we both are. You know, is this criminal? Is this, psychiatric? Are we going to let them go? Are they safe? Do we need to bring them in? So I think I would like to say hats off to the police departments in this county because they've really handled it very well, and we are using a team approach to try to come up with the best plan because this is all new to us, and how do we come up with the best plan for not only the patient but, like Kevin said, the community. Patient is the key at this point. It's just getting the word out. So many people don't even know what it is. What does it look like? How is it used? So just that basic education of, here's where you can buy it, here's how it's used, and here's the effects.
Help is available by either contacting crisis intervention, by contacting one of our treatment providers, White Deer Run, New Perspective, Pennsylvania Counseling. There's help available for people.
7 number is 717-274-3363.